Interesting story tucked away. It really is tucked away, actually, in the pages of the Times today, concerning Health Secretary Wes Streeting. He says the NHS should turn away racist patients. This as Muslim GPs are reporting they're scared to carry out home visits. He says racist abuse against NHS staff, and I quote, brings shame on our flag and on our country. 2 GP surgeries in East London will close early today amid fears for staff and patient safety. So that's legal practices that are closing, doctors' offices that are closing, doctor surgeries, that are closing. That's Britain in 2024. I'm not blaming the doctors, by the way, please, I'm not blaming them for a second. They're both in Walthamstow. They said they have had threatened disruption with plans to target a nearby immigration bureau. Elsewhere, Muslim GPs say they're afraid to carry out home visits, and the Royal College of GPs said staff must travel in groups for safety. The London Ambulance Service said staff had reported an increase in racial abuse and hostility. On Friday, 2 Filipino nurses were attacked as they travelled to work to provide emergency cover during unrest in Sunderland. Wes Streeting says these people bring enormous shame on the country. People who are abusing NHS staff can be turned away and should be turned away. So what of that idea? Ali, is it the 2-tier policing aspect you'd like to pursue, or Elon Musk? Good morning.
Yeah, good morning, Nick. I just really want to talk about one thing, which is basically the 2-tier policing. I believe there is a systematic malicious action towards Muslim community because what happened, we hear, like I've been looking into the social media recently, and if you look at it, and what happens, they're always calling the people who did the Hair Hill riots in Leeds. They said that the Muslim community, why the police, they didn't deal with them as they are dealing at the moment with what happened in the riots. The Hair Hill riots are what happened in that. It's led by European communities.
These were the Roma. Now, this was the week I was out of the country, but this was the Roma people when some children were taken away from a property in Leeds. This is what you're referring to. Yeah. Exactly.
Right. And okay. when I was looking really at the social media, they were always talking about, look what happened. They don't deal with Muslims as they are dealing with what happened. They didn't deal with Muslim elites as they are doing with what they do with our lads here when they did the riots.
Yes.
And I believe it's really a lot of misconceptions, a lot of misinformation that's happening.
Well, you're right. You're absolutely right. But there are other incidents, are there, that we can point to, which is why people think there is 2-tier policing. Not least what happened outside the pub in Birmingham 2 days ago, when one of my colleagues was chased around the block.
I mean, that's correct. What they do, what Tom Swarbrick yesterday was talking about, like when you talk about like mass problems and problems that can really affecting a whole community,
yep.
The police has the right to deal with it in a different way that when they're dealing with a single problem. And I believe that the other caller, when he called about like talking about like getting Tommy Robinson and his gangs around the table, to a lot of people and a lot of people, and not just Muslims. Tommy Robinson is as terrorist as Osama bin Laden because he is really staining a whole community, trying to make a riot and disruption to a lot of people. I mean, I'm not calling black people. My daughter is 7 years old. Yesterday, she couldn't go to bed because she was looking at TV, and she said, "Baba, my dad, are we going to go into war?"
Let me ask you this lastly, if I may, Ali. How safe do you feel for you and your family?
Look at me. I'm a GP. My family are consultants in hospitals. They are IT consultants. They're accountants. They're workers. They trade people. All of us feel very unsafe, to be honest. Okay. I live here. I've never thought anything like that to happen. I've never really encountered any kind of racism in this country.
Can I ask you one final question, sir, as you are a part of our NHS? If you are on duty at the hospital or the clinic that you work at, and a far-right protester was brought in to you because his head was split open, he'd been hit by a brick, he had the flag of St George, and he had a T-shirt on which he'd written the P word, go home, would you treat him?
Definitely. This is my duty. This is my duty to treat anyone. I'm not really dealing with anyone. I will deal with any people, regardless of the background, regardless of the religion, regardless of what they are doing, whether they agree with my thoughts. When I'm a doctor. I'm I'm treating people. This is what I did all for. This is when I've done where I graduated.
And if they abused you, and if they said, and please, this is only for purposes, get your hands off me, I want a white doctor, again, you would treat him? Ali?
Do you believe that happened to me? That happened to me once or twice. Unfortunately, throughout my whole career in the UK, and I was laughing to them, and I said they didn't say exactly that. They said, "Where's the white doctor? Why the white doctor's not here?" I've been telling them there are a lot of white doctors here. There are a lot of really people, and we part of this community, and this really can turn to be a joke and turn to be like laughter afterward, but. It's unfortunately really what we are saying. What I am saying, I'm appealing to the community to look for real information.
I must leave it there. Thank you for the work you do, your family have done, for the National Health Service, of people like you. Thank you, Ali. Be well and keep your family safe. That aspect, otherwise, something the idea of someone getting hit with a brick or whatever, we're going to be looking at later, as the Health Secretary Wes Streeting has said, that if people are abusive in hospitals to people because of their ethnicity, their faith, their clothing, whatever, the NHS should look at a position, well, I'm not going to treat you. Is that fair? Stephen's in Westminster. Stephen, your view of what Wes Streeting is floating today. Good morning.
Good morning, Nick. First-time caller, long-time listener.
Great to have you on board, sir. Thank you, Stephen.
Fantastic. Right, let me just get straight to the point. Wes Streeting, he really should think before he makes such comments.
Right.
If you take his view that doctors could, or healthcare professionals in general, could start to select which patient they may wish to choose, and they were his sort of words.
They were,
I believe he also threw it.
People who were abusing NHS staff can be turned away and should be turned away.
OK, let's put the boot on the other foot. How about somebody comes in who's murdered a child and is abusive? How about somebody coming in who's committed a terrorist atrocity in the UK, may have even been shot by the police, may be in dire need of life-saving treatment? What do? Do we then select that we're not going to treat them people? I just don't think that the thought process he's used has really come across in his statement. It's a knee-jerk reaction to a reaction we're already seeing on the streets, which is a shame that people are taking these sort of massive steps and rioting and causing problems, but people are disaffected and people are unhappy.
I take you back to the killing of Fusilier Lee Rigby in Woolwich by two people who I won't identify, who are now serving life terms. Having shot those two people, the first people who then attended and started to provide for first aid were the armed officers from the Met who'd shot them. So having got them down, having gone over, because I've spoken to one of them, and kicked the weapons away from them, the knives away, they then started to apply, CPR or whatever, to try and save their lives.
Yeah, as they should do.
Absolutely.
Human life is a valuable thing, and nobody should want to take it from anybody else. But we can't start to pick and choose who we treat on their political views or the atrocities they may have committed. We are humans after all, and I believe it's our duty to protect each other.
We are, Stephen. Great to have you as a first time. Look after yourself. Look forward to our second conversation. Be like Stephen. Get it off your chest. Get it on the radio, and call me on 05. No idea what the next number is. I'd go higher. Let's go 058. Next one's got to be lower. 4. I'll end there. Am I anywhere near? Who knows? Steve's in Blackpool. Steve, what do you make of what Wes Streeting is saying?
Yeah, I'm just going to mirror what Steve's just said in Westminster. During World War II, British medics treated German soldiers, completely opposite sides.
What a good point.
During Iraq, the insurgency, they were treated by British medics when they were injured. Afghanistan, Taliban fighters were treated by British medics and things like that, so we kept them alive and that kind of stuff. So we were all citizens of this country, and people think different ways, and it's not for us. So you cannot pick and choose.
I'm going to take it a slightly different way. So you are running Blackpool Royal Infirmary, or whatever your hospital is called.
Queen Vic.
Sorry, sir? Queen Vic?
Blackpool Victoria.
Blackpool Vic, right. You're running the Blackpool Vic, and it comes to you that a nurse has requested not to treat a patient because the nurse is a Muslim girl, and he's come in with his T-shirt saying, P word, go home, and she doesn't want to treat him. What action would you take?
A reminder of the Hippocratic Oath.
Sorry, matey. The Hippocratic Oath?
Yeah. First, do no harm and treat all people equally.
She's got to look at, even though he's got that written on the T-shirt, and she's rather unsettled by that, or he, for that matter.
Do you think that those police officers that you just mentioned before were happy about having to treat people? It's their duty. It's to save life. And if you're going to join the NHS, your main principle is to save life and to, stop people from being in pain and things like that. You cannot pick and choose who you treat, because if you start to pick and choose who you treat, then it would be like, well, he doesn't think like me. I don't really want to treat him. It's a slippery slope.
He's a United supporter, not a City supporter or something like that.
Exactly.
Yeah. I see what you're saying. OK, good luck at the Blackpool Victoria Hospital. Steve, thank you, sir, for that. Jenny's in Basildon. Jenny, what would you say to that nurse if he or she says, I don't want to treat this person? Morning.
No, I agree with them completely.
But you're there. You're, if you are a nurse, you've taken the Hippocratic Oath.
Yeah, but I don't take a Hippocratic Oath to be abused.
They're not abusing you. Because if by the way, if a nurse, she can call security, but this person is just clearly has racist tendencies because of the T-shirt he's wearing.
No, I just don't think. If you're in a profession, you bear in mind those nurses, doctors, everything, they spend years training, okay?
Yes.
For the good of everybody. They don't distinguish between black, white, Asian or whatever. You know, I've always had an Asian doctor. I love Asian doctors. They've been the best.
Right.
And I just cannot get my head around the fact that someone who needs medical care will go to a hospital and say, you're not treating me. It's absolute ignorance.
I agree.
And I think, can I just say one more thing, Nick? This is about how to stop these riots, yeah?
Go on.
Well, we've not had a word from the King. Not one word. Okay.
Right. I don't know that you want to have the monarch commenting on lawless. Jenny, I don't know.
No, this isn't about politics. This is about he needs to get on the TV, make an appeal to everybody just to stop.
I think you'd set a very dangerous precedent. I'm racing from memory. I don't think the Queen addressed the country after the 1980 riots. I don't think.
No, but they need to. They're changing. The monarchy needs to change. They need to change.
Hold on. We can't have the monarchy involved in political matters. That is.
This isn't politics. This is violence. This is people dying, getting injured.
It's fuelled in part by political policy, isn't it? So.
Yeah, but it's also fuelled in part by social media, by just.
Okay, question. I mean, it's a really. I'm very grateful you raised it because it's a really interesting idea. Lastly. Do you think people who are prepared to throw bricks at police officers and actually at police dogs, do you think they'd listen to the words of the King?
Yeah, I do. They're supposed to be patriots.
They're not patriots.
They love their country. We love our Union Jack. Yeah?
Well, they don't love the Union Jack that I support and that I salute and would stand up to at various ceremonies. They're not the sort of patriots that I recognise. They're thugs who just want to ruck. What are you going to tell me? You're in the NHS, is that right?
Yes.
Well, thank you for that. What do you do?
I work as a paramedic. I'm a first-time caller, so I'm a little bit nervous.
Oh, there's nothing to be nervous about, for heaven's sakes. The work you do, for goodness me. Well, thank you for the work you do. How long have you been a paramedic?
About 3 years.
Enjoying it?
Yeah, no, I love it. I get to help my community and advocate for patients that sometimes have a marginalised voice, so that's nice.
It's not kicked off in Loughborough yet, but if it did and you found yourself called to attend to some people who maybe they'd thrown a metal pipe and it had hit somebody else on the back of the head, how would you react?
I mean, obviously, it's a horrible situation, everything that's going on at the moment. Myself, I am black, and it is something that I have dealt with personally.
When you say it is, what racism you mean?
Yeah, racism.
What happened?
Threats. So I've quite recently had a patient who was found drunk on the side of the road, and as soon as he saw that I was the one that was going to treat him, he became very aggressive, tried to attack me, and slur of abuse that, I hadn't heard for quite a long time. Where I live is quite diverse, so it was quite intense. However, we have a duty of care.
Yeah.
Much as I agree with your last caller, if someone doesn't consent and they've got capacity, then obviously I can't touch them. That would be counted as assault. Mm-hmm. But if they are if they've got a head injury that is causing them to be sort of irrational, or if they've got a life-threatening condition that could deteriorate, I have a responsibility to sort of stay and wait and treat them with the same care that I would give anyone else.
Are there any circumstances, other than that your physical safety is under threat, are there any other, obviously if someone's, you think that your life's in danger, are there any other circumstances in which you can say to your line manager, I'm not going to treat this person? Oh,
100%. And I'm a big advocate for that, especially because I work with a lot of new staff and trainees. I ensure that, listen, if this person is sort of okay, there's not really a high risk of deterioration, if they've just got sort of minor injuries and they're being really abusive, we do not have to tolerate that. I will not tolerate that. You do not have to tolerate that. Like the previous caller said, I don't come to work to be abused.
No, of course not.
I come to work to do my job. I do not care who you are, what you look like. And there's been times where I've had to treat people who have committed heinous crimes, like sex offenders, or people who've been all sorts of people.
Yeah.
There's no go to specifics, and that gets put into the back, and you just sort of do your job. But at the same time, I am a human being. I have feelings, and I'm not going to stand there and sort of tolerate you sitting there and abusing me just because of what you've seen on the outside. You don't know me as an individual. It's the first time you've met me,
Thank you for the work you do, and what a refreshing attitude you have towards it, Sarah. Have a safe day at work today if you're out. Bernard in Croydon texts, I say no to turning racists away from medical care. The racists might in turn see that people from overseas are people just like other people. They might, Bernard, but if they've got such warped views that they automatically take against someone simply because of what they're wearing or the colour of their skin, do you think they've got to have that level of intelligence? Not so sure.